So yeah, we got dropped here. So live now. So to reiterate, I hear the term slipped disc thrown out a lot lately. And what exactly is a slipped disc? Is it a real medical term? And what's the best classification, best treatment? So I'm just going to switch to the other mode so you guys could see my screen, what I'm looking for. So this is a great visual to understand what's going on with the disc. So this is looking down at a cross section of the human body. This is the disc itself. It's made up of two components. It's made up of what's called the nucleus pulsus, which is the middle, and the outer layers, which are called the annulus fibrosus. These tissues are made up primarily of collagen and water, and do not have a very good blood supply once someone is about 20 years old. This area definitely has innervation because years ago, it was taught that this area did not have innervation. So this structure right here is a spinal cord. These are the spinal nerves. This is the spinous process, which is bone, and these are the lamina, which carry the weight. This view right here is a side view of what's going on. So you hear the term slip disc or, oh my gosh, I threw out my disc and now it's slipped. It's not a real medical term. There's different classifications of what could happen to your disc. Bulging is one of them. Herniated is another one. Prolapse and extrusion. These are all things that are medical terms that could happen to your disc. Uh, okay, locked. But slipped is not one of those terms that is accepted in the medical community. But, layman's term, you could say, hey, I slipped my disc. And people understand what's going on. But let me, just briefly show you what happens here. So this nucleus, this is the center. What happens is if you irritate this nucleus or this middle will start bulging, hence the term bulge. And what happens as it bulges on the left-hand screen, you can see that black stuff going on. That's called desiccation or drying out of. Typically, when we look at an MRI of someone that has back pain and they've had it for a while, we'll start to see some blacken on their MRI. That's why when patients come to my office or they're considering coming to the office, they'll send me their MRIs prior to coming in, and I'll do a complimentary consult just to look at their MRIs, and we can almost always see that the disc level that they're having their symptomatology is black. So it's losing some of its water. It'll start losing some of its height. So there we go. We start seeing desiccation of the disc. And we can see on the screen, the more it starts bulging, this is considered what's called a herniation. Once it's putting pressure on that nerve, there's a herniation right there. Okay, so this could be called slipped, but again, you'll never see the term slipped in an MRI or a CAT scan report or any medical terminology. It'll be thrown around by patients saying, "Hey, doc, I think I slipped my disc," and usually those people will walk in antalgic or hunched over, in a lot of pain. But we don't want to. We want to have them understand what's going on. The next one we call a disc extrusion, when the disc material, and I'll demonstrate it right here, actually is no longer contained. So this outer layer is called your annulus. The center layer is called the nucleus. Once this nuclear material leaves the outer layer, it will become an extrusion or floating free fragment. These generally are the biggest pain because once it's left, your body can and does reabsorb this material, but once it's left, it's a lot harder to treat because it will cause a chemical irritation that doesn't go away on its own. Usually, these patients will respond to conservative treatment like chiropractic care and or spinal decompression, but they're a lot harder to treat. So that's jumping ahead, but I just wanted to kind of show you what the term disc herniation, the different classifications, and then really just quickly go into how I treat it. I specialize in a technique called the Cox technique. This here is just a really simplified uh, understanding of what's going on. So let's look at this image here. So this is the spine. This would be the person laying on their back. This would be a nice, happy, and healthy disc. And you see this yellow structure is a nerve. This nerve has room. This here is an irritated nerve. And we can see that this disc is decreased in height. And this view, we can see that this disc here is herniated and putting pressure on that spinal nerve. So wherever that spinal nerve is going, whether it's going, and I'll just pull up another graphic real quick. So if that spinal nerve is going, let's say, peripherally, or we'll do a dermatome. If it's an L5, which again is one of the most common disc problems, you might have symptomatology down that leg. We call that sciatica. Okay, it might even be in that dermatome. And dermatome is basically where that nerve is innervates it. So right there, we see that. So let's jump back to that other screen here. So what we do is we want to unload that disc, taking gravity off that disc. And the process of spinal decompression, I utilize what's called a DRX 9000, which machine, sorry about that, I'm back to being live, which will help unload that disc and take pressure off that irritated nerve. It is a process. It does take time, but what's best about spinal decompression or the Cox technique or both of those techniques combined, which is what I utilize in my practice, is we're unloading that disc, we're helping to return blood flow back to this disc, and we are decreasing pressure inside that disc. When this disc has pressure, it will form this bulge or herniation that will put pressure on that nerve. And I know you're feeling that if you're watching that video. So, what are your options? Basically, what I think is the most logical option, as opposed to doing, let's say, something invasive like surgery, which, doesn't always have the best results, or taking pain medication, which again doesn't address the cause of the problem, is exhausting all your non surgical methods first. And, spinal decompression and chiropractic care, in my opinion, is one of the best treatment options. So, if you're hurting right now and you're watching this video and you happen to bump into it, if you have a bulging, herniated, slipped, prolapsed, extruded disc, or all of the above, or just starting to get the beginning phases of it, consider chiropractic care first, with an emphasis on something that's going to address the disc. So whether it's the Cox technique, which will help address the disc, or it's a form of spinal decompression, which will get to the root cause of the area, that, in my opinion, is one of the best treatment modalities you could utilize before committing to something as painful as a surgery, which doesn't provide the best long-term results. So hopefully, if you're watching this video, if you have any questions, please DM me. Chiropractor. See, boom.